Question 1. Stakeholder feedback indicates a growing concern regarding the perceived relevance and impact of the organization's current strategic objectives. As a certified public manager, what is the most appropriate approach to address this feedback and ensure the strategic plan remains effective? Option A. Conduct a comprehensive review of the strategic plan, integrating stakeholder feedback into a revised SWOT analysis, and subsequently updating goal setting and implementation plans based on this analysis. Option B. Implement minor adjustments to the language of the current strategic plan to reflect the general sentiment of the feedback, without undertaking a full analytical review or revising core objectives. Option C. Acknowledge the feedback in a public statement but maintain the current strategic plan, asserting that existing objectives are well-founded and require no immediate alteration. Option D. Immediately revise the strategic objectives to directly address the most frequently cited concerns from the stakeholder feedback, prioritizing immediate action over further analysis. The correct answer is A. Conduct a comprehensive review of the strategic plan, integrating stakeholder feedback into a revised SWOT analysis, and subsequently updating goal setting and implementation plans based on this analysis. Explanation. This scenario presents a professional challenge because it requires a public manager to balance competing stakeholder interests and translate qualitative feedback into actionable strategic adjustments within the established regulatory framework of the Certified Public Manager (CPM) program. The core difficulty lies in moving beyond simple acknowledgement of feedback to a structured, evidence-based approach to strategic planning and management, ensuring that any proposed changes align with the organization's mission, vision, and values, and are subject to rigorous implementation and evaluation. Careful judgment is required to avoid reactive decision-making and to ensure that the strategic plan remains a dynamic, yet grounded tool for organizational improvement. The correct approach involves a systematic process of integrating stakeholder feedback into the existing strategic planning cycle. This begins with a thorough analysis of the feedback to identify recurring themes and their potential impact on the organization's mission, vision, and values. Subsequently, this analysis informs a revised SWOT, strengths, weaknesses, opportunities, threats assessment, which then guides the setting of specific, measurable, achievable, relevant, and time-bound, SMART goals. The final step is the development of a clear implementation plan with defined responsibilities and metrics for ongoing evaluation, ensuring accountability and continuous improvement. This approach is justified by the fundamental principles of strategic management emphasized in the CPM curriculum, which mandate a data-driven and iterative process for organizational effectiveness. Adherence to these principles ensures that strategic decisions are not arbitrary, but are rooted in a comprehensive understanding of the internal and external environment and stakeholder perspectives, aligning with the ethical obligation of public managers to serve the public interest effectively and efficiently. An incorrect approach would be to immediately implement changes based on the most vocal stakeholder group's suggestions without a comprehensive analysis. This fails to consider the broader impact on the organization's mission, vision, and values, and bypasses the critical step of a SWOT analysis, potentially leading to misallocation of resources or unintended negative consequences. This approach violates the principle of systematic strategic planning and could be seen as a failure to exercise due diligence in management. Another incorrect approach would be to dismiss the feedback as anecdotal and proceed with the current strategic plan without any modification. This ignores the valuable insights provided by stakeholders, which are crucial for identifying potential weaknesses or emerging threats not previously recognized. It represents a failure to engage with the external environment and adapt the strategy accordingly, potentially leading to organizational stagnation and a disconnect from the needs of those the organization serves. This approach neglects the iterative nature of strategic management and the importance of stakeholder engagement. A third incorrect approach would be to conduct a superficial review of the feedback and make minor, cosmetic adjustments to the existing plan without a deep dive into the underlying issues. This approach fails to address the root causes of any dissatisfaction or concerns raised by stakeholders and does not constitute genuine strategic adaptation. It is a failure to engage in rigorous analysis and goal setting, undermining the credibility and effectiveness of the strategic planning process. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the problem or opportunity presented by the stakeholder feedback. Second, gather and analyze relevant data, including the feedback itself, internal performance metrics, and external environmental scans. Third, engage in a comprehensive strategic planning process, which includes revisiting the mission, vision, and values, conducting a thorough SWOT analysis, and setting SMART goals. Fourth, develop a detailed implementation plan with clear metrics for evaluation. Finally, communicate the process and outcomes to stakeholders, demonstrating transparency and accountability. This framework ensures that decisions are informed, defensible, and aligned with the principles of effective public management. Question 2. Performance analysis shows a consistent decline in the timeliness of critical public health service delivery across multiple program areas within a state-level public health agency. The agency is currently undergoing its triennial accreditation review. Which of the following approaches best aligns with both the principles of accreditation and recognized quality improvement methodologies for addressing this performance gap? Option A. Focus solely on identifying individual staff members who are consistently late in service delivery and implement a performance improvement plan for each identified individual. Option B. Conduct a series of focus groups with frontline staff to gather anecdotal feedback on perceived workload issues and then implement a few hastily developed solutions based on this feedback. Option C. Initiate a comprehensive review of all relevant policies and procedures, followed by the implementation of a Plan Do Study Act (PDSA) cycle, focused on identifying and addressing bottlenecks in service delivery workflows. Option D. Immediately implement mandatory overtime for all staff involved in service delivery and conduct a series of general refresher training sessions on time management. The correct answer is C. Initiate a comprehensive review of all relevant policies and procedures, followed by the implementation of a Plan Do Study Act (PDSA) cycle, focused on identifying and addressing bottlenecks in service delivery workflows. Explanation. This scenario is professionally challenging because it requires balancing the imperative for continuous quality improvement with the rigorous demands of accreditation standards, all within the specific regulatory framework of the Certified Public Manager (CPM) program. The agency's performance data indicates a need for intervention, but the chosen method must be both effective and compliant with established quality improvement methodologies recognized by CPM standards. Careful judgment is required to select an approach that not only addresses the identified performance gaps, but also aligns with the principles of accreditation, which emphasizes systematic processes for achieving and maintaining high standards of public health practice. The correct approach involves utilizing a structured quality improvement methodology, such as a Plan Do Study Act (PDSA) cycle, to systematically analyze the root causes of the performance decline and implement targeted interventions. This approach is justified by CPM accreditation guidelines, which typically mandate the use of evidence-based quality improvement processes to ensure accountability and effectiveness in public health operations. PDSA cycles are a cornerstone of quality improvement, providing a framework for iterative learning and adaptation, which is essential for sustainable performance enhancement and meeting accreditation expectations for continuous improvement. An incorrect approach would be to implement immediate, unanalyzed changes without a systematic process for evaluation. This fails to address the root causes of the performance issues and lacks the structured approach required for accreditation. Another incorrect approach would be to focus solely on punitive measures or staff retraining without understanding the systemic factors contributing to the performance decline. This neglects the principles of quality improvement, which emphasize process and system analysis over individual blame, and would likely not satisfy accreditation requirements for comprehensive quality management. A further incorrect approach would be to rely on anecdotal evidence or superficial fixes, which do not provide the data-driven insights necessary for meaningful and sustainable improvement, and are antithetical to the rigorous standards of CPM accreditation. Professionals should employ a decision-making framework that begins with a thorough analysis of performance data to identify specific areas of concern. This should be followed by an assessment of existing quality improvement processes and their alignment with accreditation standards. The selection of an appropriate quality improvement methodology, such as PDSA or Six Sigma, should be based on the nature of the problem and the agency's capacity. Implementation should be followed by rigorous evaluation and adaptation, with a clear focus on demonstrating progress towards accreditation goals and sustained performance enhancement. Question 3. Operational review demonstrates that a recent public health advisory regarding a novel infectious disease has been met with widespread confusion and a significant amount of misinformation circulating on social media. The Certified Public Manager, CPM, responsible for public communication needs to address this situation effectively. Which of the following strategies best aligns with the principles of effective communication, media relations, crisis communication, and health literacy within a public sector context? Option A. Post a brief disclaimer on the agency's website acknowledging the misinformation and encouraging citizens to rely on their own research. Option B. Develop a multi-platform communication plan utilizing clear, simple language, visual aids, and targeted messages for diverse demographics, while proactively engaging with media outlets and establishing a dedicated crisis communication team for rapid response. Option C. Issue a single, detailed technical report to the press and direct all public inquiries to a general government hotline. Option D. Focus all communication efforts on social media influencers to disseminate information, assuming they can effectively translate complex health messages to their followers. The correct answer is C. Issue a single, detailed technical report to the press and direct all public inquiries to a general government hotline. Explanation. This scenario presents a professional challenge due to the critical need for accurate, timely, and empathetic communication during a public health crisis. The Certified Public Manager, CPM, is tasked with navigating complex information dissemination, managing public perception, and ensuring that health literacy principles are applied to make vital information accessible to all segments of the population. The challenge lies in balancing the urgency of the situation with the need for precision, avoiding misinformation, and maintaining public trust, all while adhering to relevant public sector communication guidelines and ethical standards. The correct approach involves developing a multi-channel communication strategy that prioritizes clarity, accessibility, and factual accuracy. This strategy should leverage various media platforms to reach diverse audiences, employing plain language and visual aids to enhance health literacy. It necessitates proactive media engagement, providing spokespersons with consistent messaging and accurate data, and establishing clear protocols for responding to inquiries. Furthermore, a robust crisis communication plan, which includes pre-approved messaging templates and designated communication teams, is essential for swift and coordinated responses. This approach aligns with the ethical imperative of public service to inform and protect citizens, ensuring that information is not only disseminated, but also understood and acted upon effectively. Regulatory frameworks for public communication emphasize transparency, accountability, and the prevention of public harm through misinformation. An incorrect approach would be to rely solely on a single communication channel, such as press releases, without considering the varying levels of health literacy or access to information among different demographic groups. This fails to meet the ethical obligation to ensure broad comprehension and could exacerbate health disparities. Another incorrect approach is to engage in reactive communication, waiting for media inquiries or public outcry before providing information. This can lead to the proliferation of rumors and a loss of public confidence, violating principles of proactive public engagement and transparency. Furthermore, providing incomplete or overly technical information to the media without clear explanations or context demonstrates a failure to consider health literacy and can result in misinterpretation and public confusion, potentially leading to harmful health decisions. This also neglects the importance of building trust through consistent and accessible messaging. Professionals should employ a decision-making framework that begins with a thorough assessment of the communication objectives and target audiences. This should be followed by the development of a comprehensive communication plan that integrates health literacy principles and crisis communication protocols. Evaluating the effectiveness of communication strategies through feedback mechanisms and adapting the approach as needed is crucial. Adherence to established public sector communication, guidelines, and ethical codes of conduct should guide every communication decision, ensuring that actions are transparent, responsible, and in the public interest. Question 4. Compliance review shows that the county's public health infrastructure is significantly underperforming in key areas, including insufficient trained personnel for disease surveillance, outdated data management systems hindering timely reporting, and a lack of specialized laboratory equipment for emerging health threats. The available budget for infrastructure improvements is limited and subject to annual appropriations. What is the most appropriate approach for the certified public manager to address these deficiencies? Option A. Develop a phased implementation plan that prioritizes critical workforce training and data system upgrades, while simultaneously exploring collaborative funding opportunities with state and federal agencies and private foundations for laboratory equipment acquisition. Option B. Implement a new, comprehensive electronic health record system across all public health departments, assuming that improved data management will naturally lead to better workforce utilization and laboratory efficiency. Option C. Immediately allocate the entire available budget to purchasing the most advanced laboratory equipment to address the emerging health threats, deferring workforce training and data system improvements until future budget cycles. Option D. Propose a significant increase in the public health budget to address all identified deficiencies comprehensively in a single fiscal year, and if denied, maintain the status quo due to insufficient resources. The correct answer is A. Develop a phased implementation plan that prioritizes critical workforce training and data system upgrades, while simultaneously exploring collaborative funding opportunities with state and federal agencies and private foundations for laboratory equipment acquisition. Explanation: this scenario presents a professional challenge because it requires a certified public manager, CPM, to navigate the complexities of implementing a critical public health initiative within a constrained environment. The challenge lies in balancing the urgent need for improved public health infrastructure with the practical realities of limited resources, competing priorities, and the need for stakeholder buy-in. Careful judgment is required to ensure that the chosen approach is not only effective in addressing the identified deficiencies, but also compliant with relevant regulations and ethical standards for public resource management. The correct approach involves a phased, data-driven strategy that prioritizes essential components of the public health infrastructure, focusing on immediate needs while planning for long-term sustainability. This approach is correct because it aligns with the principles of responsible public administration and fiscal stewardship. Specifically, it demonstrates a commitment to evidence-based decision-making by using the compliance review findings to inform resource allocation. Prioritizing workforce development and data system enhancements directly addresses foundational elements of a robust public health system, as outlined in typical public health frameworks that emphasize the importance of skilled personnel and accurate information for effective disease surveillance, response, and program delivery. Furthermore, seeking collaborative funding mechanisms and phased implementation acknowledges the fiscal realities and promotes long-term viability, which is a key ethical consideration for public managers responsible for the efficient and effective use of taxpayer money. This approach also fosters transparency and accountability by involving stakeholders and demonstrating a clear plan for improvement. An incorrect approach that focuses solely on immediate, visible infrastructure upgrades without addressing underlying workforce or data system weaknesses would be professionally unacceptable. This failure stems from a lack of strategic planning and a misunderstanding of what constitutes a truly robust public health system. Such an approach would likely lead to inefficient resource allocation, as new facilities or equipment might be underutilized or unmanageable without adequate trained personnel or reliable data to guide their use. This violates the ethical duty of a CPM to ensure the efficient and effective use of public funds. Another incorrect approach that involves deferring all improvements due to perceived insurmountable funding challenges without exploring alternative or phased funding strategies would also be professionally unacceptable. This demonstrates a lack of initiative and a failure to proactively seek solutions. Public managers have an ethical obligation to explore all avenues for resource acquisition and to advocate for necessary investments in critical public services. Simply accepting the status quo without diligent effort to overcome financial hurdles is a dereliction of duty and fails to uphold the public's right to adequate public health services. A third incorrect approach that involves implementing new technologies or programs without adequate staff training or a clear data collection and analysis plan would be professionally unsound. This would likely result in wasted resources, failed initiatives, and potentially compromised public health outcomes. It demonstrates a disregard for the human element of public health infrastructure and the critical role of data in informing effective interventions, violating the ethical principle of competence and due diligence. The professional decision-making process for similar situations should involve a thorough assessment of the compliance review findings, identifying the root causes of deficiencies. This should be followed by a strategic planning phase that prioritizes interventions based on impact, feasibility, and regulatory requirements. CPM should actively engage stakeholders, explore diverse funding opportunities, and develop phased implementation plans that allow for adaptation and continuous improvement. Ethical considerations, such as equity, transparency, and accountability, must be integrated into every stage of the decision-making process. Question 5. The efficiency study reveals a significant gap in access to preventative health screenings between urban and rural populations within the jurisdiction. Considering the historical evolution of public health, which approach best aligns with the regulatory framework and ethical principles for addressing this disparity? Option A. Reduce the overall budget for preventative health screenings to reallocate funds to more immediate public safety concerns, arguing that general safety takes precedence over specific health access issues. Option B. Focus solely on public awareness campaigns through mass media, believing that increased general knowledge will naturally lead to greater utilization of available services, regardless of geographical barriers. Option C. Implement a targeted outreach program in rural areas that utilizes mobile health units and community health workers, drawing on lessons from historical public health campaigns that successfully reached underserved populations by adapting delivery methods to local contexts. Option D. Allocate additional funding to existing urban health clinics, assuming that improved urban services will eventually have a trickle-down effect on rural areas through knowledge dissemination. The correct answer is C. Implement a targeted outreach program in rural areas that utilizes mobile health units and community health workers, drawing on lessons from historical public health campaigns that successfully reached underserved populations by adapting delivery methods to local contexts. Explanation: the efficiency study reveals a significant disparity in public health outcomes across different demographic groups within the jurisdiction. This scenario is professionally challenging because it requires a certified public manager, CPM, to not only identify the problem, but also to propose solutions that are grounded in the historical evolution of public health principles and are compliant with the specific regulatory framework governing public health initiatives within the designated jurisdiction. The challenge lies in synthesizing historical lessons with current legal and ethical obligations to ensure equitable and effective public health interventions. The correct approach involves recognizing that historical paradigm shifts, such as the move from an infectious disease focus to a broader social determinants of health perspective, inform contemporary strategies. This approach aligns with the regulatory framework by emphasizing evidence-based interventions and a commitment to health equity, which are often enshrined in public health laws and guidelines. Influential figures and key milestones in public health history provide a foundation for understanding the ethical imperative to address disparities, reinforcing the professional obligation to advocate for policies that promote the well-being of all citizens, irrespective of their background. This aligns with the core principles of public service and ethical governance expected of a CPM. An incorrect approach would be to focus solely on immediate cost-saving measures, without considering the historical context of public health failures or the long-term impact on vulnerable populations. This fails to acknowledge the evolution of public health from a reactive, disease-specific model to a proactive, population health-oriented one. Such an approach could lead to the perpetuation or exacerbation of existing health inequities, violating ethical principles and potentially contravening regulatory mandates that require equitable access to public health services. Another incorrect approach would be to implement interventions based on anecdotal evidence or outdated public health models, ignoring the lessons learned from historical successes and failures. This demonstrates a lack of understanding of the dynamic nature of public health and its evolution. It risks repeating past mistakes and failing to leverage the advancements in understanding disease causation and prevention that have emerged over time. This approach would be professionally deficient, as it lacks the rigor and evidence-based foundation required by modern public health practice and regulatory oversight. A third incorrect approach would be to prioritize interventions that benefit the majority without adequately addressing the specific needs of marginalized groups. This overlooks the historical struggle for public health to become inclusive and equitable. The regulatory framework often mandates specific considerations for vulnerable populations, and failing to do so would be a direct contravention of these requirements and a breach of professional ethics. The professional decision-making process for a CPM in such a situation should involve 1. Problem identification and contextualization. Clearly define the health disparities identified by the efficiency study and understand their root causes, drawing upon historical understanding of public health challenges. 2. Regulatory and ethical review. Identify all relevant laws, regulations, and ethical guidelines governing public health within the jurisdiction. 3. Historical lens application. Consider how past public health paradigms and interventions have addressed or failed to address similar disparities. Identify lessons learned from influential figures and key milestones. 4. Evidence-based solution development. Propose interventions that are supported by current scientific evidence and align with the evolved understanding of public health, particularly concerning social determinants of health and health equity. 5. Stakeholder engagement. Consult with affected communities and relevant public health professionals to ensure proposed solutions are practical, culturally sensitive, and address the specific needs of all population segments. 6. Impact assessment and monitoring. Develop a plan to monitor the effectiveness of implemented interventions and ensure they are contributing to equitable health outcomes, with mechanisms for adaptation based on ongoing evaluation. Question 6. The assessment process reveals a critical need to understand the transmission patterns of a novel infectious disease within a densely populated urban area. To optimize the response, the Public Health Department is considering various methods for data acquisition and analysis. Which approach best balances the urgency of the public health crisis with legal and ethical requirements for data handling and individual rights? Option A. Implement a comprehensive data collection strategy that includes voluntary surveys, anonymized electronic health record data analysis, with appropriate data use agreements, and targeted contact tracing, all while adhering to strict data privacy protocols and seeking legal counsel on data sharing agreements. Option B. Delay all data collection and analysis until a complete legislative overhaul of public health data privacy laws can be enacted to ensure absolute certainty and compliance. Option C. Directly access and analyze all available patient-level electronic health records from local hospitals without specific patient consent, citing the emergency nature of the public health crisis. Option D. Prioritize the collection of publicly available social media data and news reports to infer transmission patterns, deeming it sufficient for an initial rapid assessment. The correct answer is A. Implement a comprehensive data collection strategy that includes voluntary surveys, anonymized electronic health record data analysis, with appropriate data use agreements, and targeted contact tracing, all while adhering to strict data privacy protocols and seeking legal counsel on data sharing agreements. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for public health intervention with the legal and ethical obligations to protect individual privacy and due process. A public health manager must navigate complex legal frameworks that grant broad authority for disease control while simultaneously upholding constitutional rights and established ethical principles. The process optimization aspect highlights the need for efficient yet legally sound decision-making. The correct approach involves a systematic, legally compliant, and ethically grounded process for data collection and analysis. This means ensuring that any data gathered is directly relevant to the public health objective, that consent or a legal basis for collection is established, and that privacy protections are rigorously applied. This aligns with the principles of public health law, which often grant agencies the power to collect information necessary to protect the population, but also emphasize proportionality and necessity. Ethically, this approach respects individual autonomy and dignity by minimizing intrusion and ensuring data is used responsibly. An incorrect approach that bypasses established legal protocols for data access, such as directly accessing private medical records without proper authorization or a court order, would be a significant regulatory and ethical failure. This violates privacy laws and potentially constitutional protections against unreasonable searches and seizures. Another incorrect approach, focusing solely on rapid data acquisition without considering data quality or potential biases, risks generating flawed insights that could lead to ineffective or even harmful public health policies, undermining the core mission of public health practice and violating principles of scientific integrity and responsible governance. A third incorrect approach, delaying necessary data collection due to an overly cautious interpretation of privacy regulations that paralyzes essential public health action, could lead to preventable harm to the community, representing a failure in the duty to protect public health. Professionals should employ a decision-making framework that begins with clearly defining the public health problem and the specific data needed to address it. This should be followed by a thorough review of applicable public health laws and regulations to identify the legal basis for data collection and any limitations. Simultaneously, ethical considerations, including privacy, confidentiality, and equity, must be integrated into the planning process. Seeking legal counsel when uncertainties arise and ensuring robust data security and anonymization protocols are in place are critical steps. The process should be iterative, allowing for adjustments based on legal guidance and ethical review to ensure both effectiveness and compliance. Question 7. Benchmark analysis indicates that effective public health emergency preparedness and response requires a systematic and legally compliant approach. Considering the Certified Public Manager (CPM) framework, which of the following strategies best exemplifies a comprehensive and ethically sound approach to managing a sudden, widespread outbreak of a novel infectious disease? Option A. Focus exclusively on developing and disseminating public awareness campaigns about general hygiene practices, deferring any specific interventions until the full scope and nature of the outbreak are definitively understood by external scientific bodies. Option B. Activate pre-established emergency response plans, conduct rapid needs assessments, coordinate with relevant federal and state agencies, and initiate targeted public health interventions based on scientific evidence and legal authority while ensuring transparent communication. Option C. Immediately deploy all available public health personnel and resources to the most affected areas, bypassing standard procurement procedures for essential supplies and prioritizing public communication to reassure the populace. Option D. Mobilize a task force to investigate the potential origins of the outbreak through extensive public surveillance and data collection, delaying any significant resource allocation or public health measures until a definitive cause is identified and attributed. The correct answer is C. Immediately deploy all available public health personnel and resources to the most affected areas, bypassing standard procurement procedures for essential supplies and prioritizing public communication to reassure the populace. Explanation: this scenario is professionally challenging because it requires a public manager to balance immediate response needs with long-term preparedness and compliance with established regulatory frameworks. The pressure of a public health emergency can lead to hasty decisions that may overlook critical planning, training, or legal requirements, potentially compromising both the effectiveness of the response and the integrity of the public management process. Careful judgment is required to ensure that actions are not only expedient but also legally sound, ethically responsible, and aligned with the Certified Public Manager (CPM) principles of effective governance. The correct approach involves a comprehensive, multifaceted strategy that integrates immediate response with robust preparedness and adherence to regulatory mandates. This approach is right because it reflects the core responsibilities of a public manager in emergency situations, as outlined by typical public administration principles and often codified in emergency management statutes and guidelines. Specifically, it emphasizes the importance of pre-existing plans, ongoing training, and clear communication channels, all of which are critical for an effective and lawful response. This aligns with the expectation that public managers operate within established legal and ethical boundaries, ensuring accountability and public trust. An incorrect approach that focuses solely on immediate resource deployment, without considering established protocols or legal frameworks, fails to meet the professional standards of public management. Such an approach risks violating procurement regulations, civil liberties, or environmental laws, leading to legal challenges and public backlash. Another incorrect approach that prioritizes public perception over evidence-based response planning ignores the scientific and technical expertise required for effective public health interventions, potentially leading to misallocation of resources and ineffective outcomes. Furthermore, an approach that neglects post-incident review and adaptation undermines the continuous improvement essential for future preparedness, violating the principle of learning from experience. Professionals should employ a decision-making framework that begins with a thorough understanding of the incident and its potential impact, followed by an assessment of available resources and existing emergency plans. This framework necessitates consulting relevant legal statutes, regulatory guidelines, and ethical codes of conduct. It also involves engaging with relevant stakeholders, including subject matter experts and other government agencies, to ensure a coordinated and informed response. Finally, a commitment to transparency, accountability, and continuous learning should guide all actions, from initial response to post-incident evaluation. Question 8. Investigation of the most effective and ethically sound approach for a state public health department to disseminate aggregated, de-identified data on a novel infectious disease outbreak to inform local health officials and the public, while strictly adhering to U.S. federal privacy regulations and best practices in public health informatics. Option A. Share anonymized data sets with academic researchers for independent analysis, but delay public dissemination until all research findings are peer-reviewed and published. Option B. Conduct extensive statistical modeling to predict future outbreak trajectories and disseminate only these predictive models, withholding all raw or aggregated observational data. Option C. Implement a secure online portal for authorized local health officials to access de-identified and aggregated epidemiological data, with a public-facing dashboard summarizing key trends and geographic hotspots without revealing individual case information. Option D. Immediately release raw, individual-level case data to all local health departments and the public via a public website to ensure maximum transparency and rapid awareness. The correct answer is C. Implement a secure online portal for authorized local health officials to access de-identified and aggregated epidemiological data, with a public-facing dashboard summarizing key trends and geographic hotspots without revealing individual case information. Explanation. This scenario presents a professional challenge due to the inherent tension between the need for timely public health data dissemination to inform policy and public awareness, and the imperative to ensure data privacy and security, particularly when dealing with sensitive health information. Public health managers must navigate complex ethical considerations and regulatory frameworks to balance these competing interests. The Certified Public Manager, CPM, designation emphasizes a commitment to ethical conduct, adherence to legal mandates, and effective management of public resources, all of which are critical in this context. The correct approach involves a multifaceted strategy that prioritizes data de-identification and aggregation before dissemination, coupled with robust data security protocols and clear communication channels for data sharing. This aligns with the principles of responsible data stewardship, which are foundational in public health informatics. Specifically, adherence to relevant U.S. federal regulations such as the Health Insurance Portability and Accountability Act, HIPAA, is paramount. HIPAA privacy rule governs the use and disclosure of protected health information. 5. Requiring covered entities to implement safeguards to protect patient privacy. The security rule mandates administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and availability of electronic PHI. By de-identifying data and using aggregation techniques, public health managers can share valuable insights without compromising individual privacy, thereby fulfilling their ethical and legal obligations. Furthermore, establishing clear data governance policies and procedures ensures that data is collected, managed, and disseminated in a consistent, transparent, and compliant manner. An incorrect approach that focuses solely on rapid, raw data dissemination without adequate de-identification or aggregation poses significant privacy risks. This would violate HIPAA privacy rule by potentially exposing PHI, leading to severe legal penalties and erosion of public trust. Another incorrect approach that involves delaying dissemination indefinitely due to an overemphasis on absolute data perfection, without considering the public health implications of delayed information, fails to meet the core mission of public health practice. Public health managers have a responsibility to use data to inform timely interventions and policy decisions. A third incorrect approach that relies on informal ad hoc data sharing mechanisms without established security protocols or data use agreements creates vulnerabilities for data breaches and misuse, contravening both HIPAA security rule and general principles of data integrity and accountability. Professional decision-making in such situations requires a systematic process. First, identify the specific data and its intended use. Second, consult relevant legal and ethical guidelines, e.g., HIPAA, public health ethics principles. Third, assess the risks and benefits of different dissemination strategies, focusing on privacy protection and public health impact. Fourth, implement appropriate technical and administrative safeguards. And fifth, establish clear communication and oversight mechanisms. Question 9. Compliance review shows a proposed community-wide vaccination campaign aimed at increasing influenza immunization rates among vulnerable populations within a specific county. While the Centers for Disease Control and Prevention, CDC, has issued national guidelines and provided grant funding for such initiatives, and the World Health Organization, WHO, has highlighted the global importance of influenza prevention. Campaign will be executed through local clinics and public health outreach programs. Which entity holds the primary responsibility for the planning, implementation, and oversight of this specific county-level vaccination campaign? Option A, the state and local health departments. Option B, the Centers for Disease Control and Prevention, CDC. Option C, the World Health Organization, WHO. Option D, a research university collaborating on the campaign. The correct answer is A, the state and local health departments. Explanation. This scenario is professionally challenging because it requires a public manager to navigate the complex and often overlapping responsibilities of federal, state, and local public health agencies, while also considering the roles of international bodies like the WHO. The core challenge lies in accurately identifying the primary responsible entity for a specific public health initiative, especially when multiple organizations have a vested interest or a role to play. Careful judgment is required to avoid misallocating resources, duplicating efforts, or failing to address critical gaps in public health response due to a misunderstanding of jurisdictional authority. The correct approach involves a thorough understanding of the statutory mandates and operational frameworks of each relevant public health organization. Specifically, it requires recognizing that while the CDC sets national guidelines and provides significant funding and technical assistance, and the WHO addresses global health issues, the primary responsibility for implementing and overseeing public health programs at the ground level, including disease surveillance, outbreak investigation, and community health initiatives, typically rests with state and local health departments. These departments are directly accountable to their respective populations and are empowered by state law to enact and enforce public health regulations. Therefore, identifying the state or local health department as the lead agency for a specific community-level public health program is the most accurate and professionally sound approach. An incorrect approach would be to solely focus on the CDC's role as a national authority. While the CDC is a critical player, its role is often advisory, funding-oriented, and focused on national strategy rather than direct, day-to-day program implementation at the local level. Attributing primary responsibility to the CDC for a local initiative without considering the state and local department's statutory authority would be a regulatory failure, potentially leading to miscommunication, inefficient resource allocation, and a lack of local buy-in. Another incorrect approach would be to solely defer to the WHO. The WHO mandate is global, and while it provides crucial international guidance and coordination, does not have direct regulatory authority over domestic public health programs within the United States. Relying solely on the WHO for a domestic program would ignore the established federal, state, and local public health infrastructure, and would be a significant jurisdictional and regulatory misstep. A further incorrect approach would be to assume that any organization with a research or funding interest, such as a university or a private foundation, holds primary responsibility for program implementation. While these entities can be valuable partners and contributors, they typically operate under the direction and oversight of public health agencies, which possess the legal authority and responsibility for public health action. The professional decision-making process for similar situations should involve a systematic evaluation of the nature of the public health issue, the geographic scope of the initiative, and the specific statutory authorities and operational responsibilities of federal, state, and local health departments. This includes consulting relevant legislation, agency mission statements, and intergovernmental agreements. When in doubt, seeking clarification from legal counsel or senior leadership within the relevant public health agencies is a prudent step to ensure accurate jurisdictional understanding and compliance. Question 10. The evaluation methodology shows that a proposed public health intervention to address a rising incidence of a chronic disease in a specific urban neighborhood has identified a significant disparity in access to preventative care between affluent and low-income residents. The program aims to provide educational resources and subsidize screenings. However, budget constraints necessitate a phased rollout, and the initial phase can only reach a portion of the target population. The project team is debating whether to prioritize outreach to the most economically disadvantaged residents, who have the greatest need but may face more logistical barriers to participation, or to focus on a more easily accessible segment of the low-income population to ensure higher initial uptake and demonstrate program success quickly. Which of the following approaches best aligns with the ethical principles and regulatory framework for public health decision-making in this scenario? Option A. Delay the program rollout until sufficient funding is secured to serve the entire target population simultaneously, to avoid any perception of inequitable resource allocation. Option B. Implement the program broadly across the entire neighborhood, accepting lower participation rates due to resource limitations, to ensure no segment of the low-income population is initially excluded. Option C. Prioritize outreach to the most economically disadvantaged residents, implementing targeted strategies to overcome logistical barriers, and transparently communicate the phased rollout plan and long-term goals to the entire community. Option D. Focus initial outreach on the more easily accessible segment of the low-income population to maximize immediate participation rates and demonstrate program effectiveness, with plans to address the most disadvantaged residents in later phases. The correct answer is C. Prioritize outreach to the most economically disadvantaged residents, implementing targeted strategies to overcome logistical barriers, and transparently communicate the phased rollout plan and long-term goals to the entire community. Explanation: this scenario is professionally challenging because it pits the principle of social justice, which advocates for equitable distribution of resources and opportunities, against the practical constraints of limited public health funding and the ethical imperative to respect individual autonomy and confidentiality. A public health manager must navigate these competing ethical considerations to make a decision that is both effective and ethically sound, adhering to the established regulatory framework for public health decision-making. The correct approach involves a multifaceted strategy that prioritizes community well-being, while respecting individual rights and ensuring transparency. This approach aligns with the core ethical principles of public health, including beneficence acting for the good of others, non-maleficence avoiding harm, justice, fairness in distribution, and respect for autonomy. Specifically, it addresses the need for informed consent by ensuring that any data collection or intervention is voluntary and that participants understand the purpose and implications. Confidentiality is maintained by protecting sensitive information. Social justice is addressed by actively seeking to mitigate health disparities and ensuring that interventions do not disproportionately burden vulnerable populations. This approach is supported by the ethical frameworks that guide public health practice, emphasizing a commitment to the common good while upholding individual dignity. An incorrect approach that focuses solely on immediate cost-effectiveness, without considering the broader ethical implications, fails to uphold the principle of social justice. Such an approach might lead to interventions that benefit a select group while neglecting or even harming marginalized communities, thereby exacerbating existing health inequities. This violates the ethical obligation to ensure fair distribution of public health benefits and burdens. Another incorrect approach that prioritizes blanket data collection without robust informed consent procedures undermines individual autonomy and trust in public health institutions. This disregards the ethical requirement for individuals to have control over their personal information and to make voluntary decisions about their participation in public health initiatives. It also risks violating privacy regulations. A third incorrect approach that relies on assumptions about community needs without direct engagement or consideration of diverse perspectives fails to adequately address social justice. Public health decisions must be informed by the lived experiences and priorities of the communities they serve. Ignoring these voices can lead to interventions that are irrelevant, ineffective, or even harmful, perpetuating systemic disadvantages. Professionals should employ a decision-making process that begins with clearly identifying the ethical principles at play, such as beneficence, non-maleficence, justice, and respect for autonomy. This is followed by an assessment of the relevant regulatory framework and legal obligations. Stakeholder engagement, including consultation with affected communities and ethical review boards, is crucial. Finally, a decision should be made that demonstrably balances these principles and obligations, with a clear rationale that can be transparently communicated. Question 11. When evaluating the allocation of scarce public health resources during a sudden, widespread outbreak, a public health manager must decide whether to prioritize immediate, widespread distribution of a limited vaccine to a broad segment of the population, or to concentrate the initial limited supply on the most vulnerable populations and healthcare workers, while simultaneously advocating for expedited procurement of additional supplies. What is the most ethically and regulatorily sound approach? Option A. Distribute the limited vaccine supply as widely as possible to a broad segment of the population to maximize immediate perceived impact and public satisfaction, even if it means fewer doses per individual. Option B. Prioritize the most vulnerable populations and healthcare workers with the initial limited supply, while actively pursuing expedited procurement of additional supplies and transparently communicating the rationale and ongoing efforts to the public. Option C. Allocate the limited vaccine supply based on political influence and public pressure, ensuring that key community leaders and vocal groups receive priority access. Option D. Withhold the limited vaccine supply until a sufficient quantity is available to vaccinate a significant portion of the entire population, to avoid the perception of inequity. Correct answer is B. Prioritize the most vulnerable populations and healthcare workers with the initial limited supply, while actively pursuing expedited procurement of additional supplies and transparently communicating the rationale and ongoing efforts to the public. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate public health needs and the long-term sustainability of essential public health infrastructure. A public health manager must balance the urgency of a crisis with the ethical obligation to ensure equitable access to resources and maintain the integrity of the system for future needs. The decision requires careful judgment, considering not only immediate outcomes, but also the broader societal impact and adherence to established ethical principles and regulatory frameworks governing public health resource allocation. The correct approach involves a transparent and equitable distribution of limited resources, prioritizing those most vulnerable and in greatest need, while simultaneously initiating a process to secure additional funding or resources for future preparedness. This aligns with the ethical principles of justice and beneficence, ensuring that the benefits of public health interventions are distributed fairly and that the well-being of the population is promoted. Regulatory frameworks for public health often mandate such equitable distribution and require proactive planning for public health emergencies, emphasizing the need for a balanced approach that addresses both immediate crises and long-term resilience. An incorrect approach that focuses solely on the immediate needs of the most vocal or influential groups, without considering broader equity or long-term sustainability, fails to uphold the principle of justice. This could lead to resentment, further exacerbate existing health disparities, and undermine public trust in the health system. Another incorrect approach that prioritizes short-term political expediency over evidence-based resource allocation, or that neglects to plan for future needs, violates the principle of prudence and the regulatory requirement for responsible stewardship of public resources. Such actions could jeopardize the long-term capacity of the public health system to respond to future threats. Professionals should employ a decision-making framework that begins with a thorough assessment of the situation, identifying all stakeholders and their needs. This should be followed by an evaluation of available resources and potential solutions, guided by established ethical principles and relevant regulations. Transparency in decision-making and open communication with the public are crucial. Finally, a commitment to continuous evaluation and adaptation of strategies based on emerging evidence and feedback is essential for effective public health management. Question 12. The evaluation methodology shows that a community health needs assessment is underway. To identify health needs and priorities, the project team is considering several approaches. Which approach best aligns with comprehensive needs assessment principles and ethical community engagement for a public manager? Option A. Employ a mixed methods approach, combining analysis of existing health records and demographic data with qualitative data collection through focus groups, interviews with community leaders, and surveys distributed to a representative sample of residents. Option B. Primarily utilize existing statistical health data from government databases, supplemented by a review of academic literature on common health issues in similar demographics. Option C. Conduct a series of town hall meetings across different neighborhoods to gather direct feedback and observe community concerns regarding health. Option D. Rely on informal conversations with a few well-connected community advocates and observations of local health service utilization patterns. The correct answer is B. Primarily utilize existing statistical health data from government databases, supplemented by a review of academic literature on common health issues in similar demographics. Explanation: this scenario is professionally challenging because it requires a public manager to balance the immediate need for data with the ethical and regulatory imperative of ensuring community trust and participation in health needs assessment. The pressure to deliver results quickly can tempt shortcuts, but these can undermine the validity and sustainability of the assessment. Careful judgment is required to select a methodology that is both efficient and respects community rights and engagement principles. The correct approach is to prioritize a mixed methods approach that combines quantitative data from existing health records with qualitative data gathered through direct community engagement, such as focus groups and interviews with key stakeholders and community members. This aligns with the principles of comprehensive needs assessment, which necessitates understanding not only statistical prevalence, but also the lived experiences and perceived priorities of the community. Regulatory frameworks for public health initiatives, even if not explicitly detailed here for the Certified Public Manager (CPM) exam, generally emphasize data integrity, community involvement, and ethical data collection. This approach ensures that the identified health needs are accurate, relevant, and have community buy-in, which is crucial for the successful implementation of subsequent health programs and policies. It also fosters transparency and builds trust, essential for long-term public health efforts. An approach that relies solely on existing statistical data, without community input, fails to capture the nuances of health needs, and can lead to misallocation of resources or the implementation of programs that do not resonate with the community. This is an ethical failure, as it bypasses the principle of community participation and can result in a superficial understanding of health issues. An approach that exclusively uses anecdotal evidence from a small, self-selected group of community leaders risks bias and may not represent the broader health needs of the entire community. This is a methodological and ethical failure because it lacks representativeness and can lead to skewed priorities, failing to address the needs of vulnerable or less vocal segments of the population. An approach that focuses solely on easily accessible data, such as publicly available demographic information, without any targeted health data collection or community engagement, is insufficient for a robust needs assessment. While demographic data provides context, it does not directly identify health needs or priorities. This is a failure in data collection methodology, leading to an incomplete and potentially misleading assessment. The professional decision-making process for similar situations should involve a systematic evaluation of available resources, time constraints, and the specific objectives of the needs assessment. It requires understanding the ethical principles of community engagement and data integrity. A public manager should first define the scope and objectives, then identify potential data sources and collection methods, critically assessing their strengths, weaknesses, and alignment with ethical and regulatory standards. Prioritizing methods that ensure both data validity and community voice is paramount. Question 13. Analysis of a situation where a certified public manager, CPM, is tasked with leading the implementation of a new environmental protection policy. The policy impacts several diverse stakeholder groups, including local businesses, environmental advocacy groups, and residents living near affected areas, each with distinct priorities and concerns. The CPM needs to build a cohesive team and foster collaboration among these groups to ensure successful policy adoption and adherence. Which of the following approaches best aligns with the principles of effective public management and team building in this context? Option A. Proactively engage all stakeholder groups by scheduling initial meetings to understand their perspectives, concerns, and potential contributions. Then facilitate a series of collaborative workshops to identify common ground and co-develop implementation strategies. Option B. Prioritize the concerns of the largest business entities, as their economic impact is significant, and inform other groups of the finalized implementation plan based on these primary considerations. Option C. Directly communicate the finalized policy implementation plan to all stakeholders and expect compliance, addressing any objections on a case-by-case basis as they arise. Option D. Focus on building consensus among the environmental advocacy groups, as they are most knowledgeable about the policy's technical aspects, and then present their recommendations to other stakeholders for approval. The correct answer is A. Proactively engage all stakeholder groups by scheduling initial meetings to understand their perspectives, concerns, and potential contributions. Then facilitate a series of collaborative workshops to identify common ground and co-develop implementation strategies. Explanation. This scenario presents a common challenge in public management, fostering collaboration among diverse stakeholders with potentially competing interests to achieve a shared objective. The professional challenge lies in navigating these differing perspectives, ensuring all voices are heard and valued, and ultimately building a cohesive team that can effectively implement the new policy. Failure to do so can lead to resistance, delays, and an ineffective policy outcome, undermining public trust and the manager's credibility. The correct approach involves actively seeking input from all stakeholder groups, acknowledging their concerns, and facilitating a dialogue where common ground can be identified. This approach aligns with principles of good governance and public administration, emphasizing transparency, inclusivity, and participatory decision-making. Specifically, it reflects the ethical obligation of public managers to serve the public interest by ensuring policies are well-informed and broadly supported. Regulatory frameworks for public managers often mandate or encourage stakeholder engagement to ensure accountability and responsiveness to the community. This method builds trust and buy-in, which are crucial for successful policy implementation. An incorrect approach that focuses solely on the immediate needs of the most vocal or powerful stakeholders ignores the legitimate concerns of others. This can lead to resentment, a perception of unfairness, and potential legal challenges if certain groups feel their rights or interests have been disregarded. Ethically, this approach violates principles of equity and fairness. Another incorrect approach that attempts to impose a solution without adequate consultation risks alienating key individuals and groups. This can create significant resistance during the implementation phase, requiring more resources and effort to overcome. It demonstrates a lack of understanding of team dynamics and collaborative problem solving, which are essential skills for public managers. Such an approach can also be seen as a failure to uphold the public's right to be informed and have a say in matters that affect them, potentially contravening administrative law principles. A further incorrect approach that avoids addressing conflicts directly or attempts to suppress dissenting opinions will likely result in unresolved tensions that can fester and undermine team cohesion. This can lead to a breakdown in communication and a reluctance to collaborate. Public management ethics and best practices emphasize proactive conflict resolution and open communication as vital for effective teamwork and achieving organizational goals. The professional decision-making process for similar situations should involve 1. Identifying all relevant stakeholders and understanding their perspectives and potential impacts. 2. Establishing clear communication channels and actively listening to all concerns. 3. Facilitating structured discussions to identify common goals and areas of agreement. 4. Developing collaborative solutions that address diverse needs where possible, and transparently explaining compromises. 5. Implementing a feedback mechanism to monitor progress and address emerging issues. Question 14. Market research demonstrates that the Public Health Agency is experiencing declining staff morale and a perceived lack of innovation in addressing chronic disease prevention programs. The agency director is considering how to best lead the team to revitalize these efforts and improve community health outcomes. Which leadership approach would most effectively align with the Certified Public Manager (CPM) framework for fostering long-term engagement and strategic advancement in this public health setting? Option A. Utilize an autocratic leadership style, making all key decisions regarding program strategy and resource allocation for chronic disease prevention unilaterally to ensure swift and decisive action. Option B. Emphasize a transformational leadership style, focusing on inspiring a shared vision for improved community health, encouraging staff creativity in program design, and empowering individuals to take ownership of their contributions to achieving ambitious public health goals. Option C. Implement a transactional leadership style, clearly defining performance metrics for chronic disease prevention programs and establishing a system of rewards and sanctions based on the achievement of these specific, measurable outcomes. Option D. Adopt a laissez-faire leadership style, allowing individual program managers and staff to independently determine the direction and methods for chronic disease prevention initiatives with minimal oversight from leadership. The correct answer is B. Emphasize a transformational leadership style, focusing on inspiring a shared vision for improved community health, encouraging staff creativity in program design, and empowering individuals to take ownership of their contributions to achieving ambitious public health goals. Explanation. This scenario presents a common implementation challenge in public health leadership, balancing established, directive approaches with more collaborative and empowering ones to foster innovation and buy-in. The challenge lies in selecting a leadership style that not only achieves immediate public health objectives, but also cultivates a sustainable culture of improvement and responsiveness within the agency, aligning with the principles of effective public administration and ethical governance. The correct approach involves adopting a transformational leadership style. This style is characterized by inspiring and motivating staff to achieve extraordinary outcomes by appealing to their higher ideals and values. In a public health setting, this translates to articulating a compelling vision for improved community health, encouraging staff to think innovatively about service delivery, and fostering a sense of shared purpose. This aligns with the Certified Public Manager (CPM) framework's emphasis on strategic vision, ethical leadership, and organizational development. Specifically, the CPMs focus on fostering an environment that encourages continuous improvement and citizen engagement, directly supports the tenets of transformational leadership. Ethical considerations in public health demand a proactive and visionary approach to addressing complex health issues, which transformational leaders are well-equipped to champion. An incorrect approach would be to solely rely on a transactional leadership style. While transactional leadership, with its focus on clear expectations, rewards, and punishments, can ensure adherence to protocols and immediate task completion, it often fails to inspire long-term commitment or foster creativity. In public health, where complex, evolving challenges require adaptive solutions, a purely transactional approach can stifle innovation and lead to staff disengagement, potentially compromising the agency's ability to respond effectively to emerging health crises. This falls short of the CPM's expectation for leaders to cultivate a dynamic and forward-thinking organization. Another incorrect approach would be to exclusively employ a laissez-faire leadership style. This hands-off approach, characterized by minimal intervention and delegation of decision-making, can lead to a lack of direction, accountability, and coordination. In public health, where clear leadership and decisive action are often critical for public safety and well-being, a laissez-faire style can result in missed opportunities, inconsistent service delivery, and a failure to address systemic issues, directly contradicting the CPM's mandate for effective management and accountability. A further incorrect approach would be to adopt a purely autocratic leadership style. While this style can ensure rapid decision-making, it often alienates staff, discourages input, and can lead to resentment and a lack of ownership over initiatives. Public health initiatives, particularly those requiring community buy-in and behavioral change, are more likely to succeed when staff feel valued and involved in the decision-making process. An autocratic style undermines the collaborative spirit essential for effective public health work and is inconsistent with the CPM's emphasis on inclusive and ethical leadership. The professional decision-making process for similar situations should involve a thorough assessment of the specific organizational context, the nature of the public health challenges, and the existing staff capabilities. Leaders should consider which leadership theories best align with the agency's strategic goals and ethical obligations. A blended approach, often leaning towards transformational leadership as a foundational style, can be augmented by elements of transactional leadership where necessary for operational efficiency, while consciously avoiding the pitfalls of laissez-faire or purely autocratic methods. The CPM framework encourages leaders to be adaptable and to continuously evaluate their leadership effectiveness in relation to public service outcomes. Question 15. System analysis indicates that a newly funded public health initiative aimed at improving community wellness is facing challenges in its initial implementation phase. The program manager has identified several key stakeholder groups, including local residents, healthcare providers, community advocacy organizations, and municipal government officials. The program's success hinges on developing and implementing a series of outreach activities and effectively managing allocated resources. The manager needs to decide on the most appropriate approach to ensure program fidelity and stakeholder satisfaction. Which of the following approaches best aligns with the principles of effective public program implementation and stakeholder management within the Certified Public Manager (CPM) framework? Option A. Prioritize immediate demands and requests from the most vocal stakeholder groups to ensure their satisfaction and continued support. Option B. Proactively engage all identified stakeholders in a structured process to gather input on program activities and resource allocation, ensuring alignment with program goals and regulatory requirements. Option C. Rely primarily on internal program staff to develop all outreach activities and manage resources, as they possess the most direct knowledge of program operations. Option D. Delegate the primary responsibility for activity development and resource allocation decisions to the largest and most influential stakeholder group to streamline the process. The correct answer is B. Proactively engage all identified stakeholders in a structured process to gather input on program activities and resource allocation, ensuring alignment with program goals and regulatory requirements. Explanation. This scenario presents a common challenge in public program management, balancing the needs and expectations of diverse stakeholders with the imperative of adhering to established program goals and regulatory requirements. The professional challenge lies in navigating potential conflicts and ensuring that program implementation remains aligned with its intended purpose and legal framework, thereby maintaining public trust and accountability. Careful judgment is required to prioritize actions that uphold program integrity while fostering positive stakeholder relationships. The correct approach involves proactively engaging all identified stakeholders in a structured manner to gather input on program activities and resource allocation. This approach is right because it aligns with principles of good governance and public administration, emphasizing transparency and participatory decision-making. Specifically, under the Certified Public Manager (CPM) framework, effective program implementation necessitates stakeholder buy-in and feedback to ensure activities are relevant, efficient, and meet community needs without deviating from the program's statutory objectives or administrative guidelines. This proactive engagement helps identify potential implementation barriers early and fosters a sense of ownership among stakeholders, leading to smoother execution and greater program fidelity. An incorrect approach that focuses solely on internal program staff for activity development and resource management fails to acknowledge the critical role of external stakeholders in program success and accountability. This neglects the regulatory expectation for public programs to be responsive to the communities they serve and can lead to misaligned activities or perceived unfair resource distribution, undermining program legitimacy. Another incorrect approach that prioritizes immediate stakeholder demands without assessing their alignment with program goals or resource constraints is also professionally unacceptable. While responsiveness is important, unchecked responsiveness can lead to scope creep, inefficient resource utilization, and a deviation from the program's core mission, violating principles of sound public financial management and program fidelity. Finally, an approach that delegates all implementation decisions to a single, dominant stakeholder group, even if they represent a significant portion of the constituency, is flawed. This can lead to a lack of diverse perspectives, potential for bias, and exclusion of other important stakeholder voices, which is contrary to the principles of equitable program delivery and comprehensive stakeholder engagement mandated by public administration standards. The professional decision-making process for similar situations should involve a systematic stakeholder analysis to identify all relevant parties and their interests. This should be followed by developing a clear communication and engagement plan that outlines how stakeholder input will be solicited, considered, and integrated into program activities and resource management. Crucially, all decisions must be evaluated against the program's stated objectives, regulatory framework, and available resources to ensure fidelity and accountability. Question 16. Research into the implementation of a new public health initiative reveals that the project manager is advocating for immediate deployment of resources to begin outreach activities, arguing that delays in planning and logic model development will hinder timely service delivery. The project manager proposes to refine the program's objectives and performance metrics as the initiative progresses, based on initial feedback from the field. What is the most appropriate approach for the certified public manager overseeing this initiative, considering regulatory compliance and best practices in program management? Option A. Authorize immediate resource deployment for outreach activities as proposed by the project manager, with a commitment to retroactively document the program plan and logic model once initial feedback is received. Option B. Prioritize the development of output-focused performance metrics and begin outreach immediately, deferring the development of outcome-based evaluation until the program has been running for a significant period. Option C. Allow the project manager to proceed with immediate outreach and resource deployment, relying on informal progress updates and anecdotal evidence to guide program adjustments, without formal documentation of the plan or evaluation framework. Option D. Insist on the completion of a comprehensive program plan, including a detailed logic model and defined performance metrics, before any significant resource deployment, while establishing a phased implementation strategy to allow for early, controlled outreach activities within the approved framework. The correct answer is D. Insist on the completion of a comprehensive program plan, including a detailed logic model and defined performance metrics, before any significant resource deployment, while establishing a phased implementation strategy to allow for early, controlled outreach activities within the approved framework. Explanation. This scenario presents a professional challenge because it requires a certified public manager, CPM, to balance the immediate need for program progress with the fundamental requirement of adhering to established regulatory frameworks for program management. The pressure to demonstrate results can tempt managers to bypass crucial planning and monitoring steps, potentially leading to inefficient resource allocation, unmet objectives, and noncompliance. Careful judgment is required to ensure that program activities are not only effective, but also legally and ethically sound. The correct approach involves a systematic and documented process of program planning, implementation, monitoring, and evaluation, underpinned by the use of appropriate project management tools and logic models. This approach is correct because it aligns directly with the principles of sound public administration and the regulatory expectations for public programs. Specifically, adherence to the principles of program management as outlined in relevant public sector management guidelines, assuming a U.S. federal or state context for CPM certification, mandates a structured life cycle for programs. This includes defining clear objectives, identifying stakeholders, allocating resources, establishing performance metrics, and conducting regular evaluations. The use of logic models ensures that the program's theory of change is explicit and measurable, while project management tools provide the mechanisms for tracking progress, managing risks, and ensuring accountability. This systematic approach fosters transparency, efficiency, and effectiveness, all of which are critical for public trust and regulatory compliance. An incorrect approach that prioritizes immediate action over documented planning and monitoring is professionally unacceptable. This failure stems from a disregard for the regulatory requirement to establish a clear program framework before significant resource commitment. Without a documented plan and logic model, program activities lack a clear strategic direction, making it difficult to assess progress or justify expenditures. This can lead to wasted resources and a failure to achieve intended outcomes, violating principles of fiscal responsibility and program effectiveness. Another incorrect approach that focuses solely on output metrics without considering the program's intended outcomes or impact is also professionally flawed. Regulatory frameworks for public programs emphasize not just the completion of activities' outputs, but also the achievement of desired changes or benefits, outcomes, and impacts. Ignoring this distinction means the program might be producing a high volume of services, but failing to address the underlying problem it was designed to solve. This represents a failure in program evaluation and a potential misuse of public funds, as the program's true value cannot be demonstrated. A third incorrect approach that neglects regular monitoring and reporting, relying instead on anecdotal evidence or infrequent reviews, is also unacceptable. Regulatory compliance and professional standards demand ongoing oversight to identify and address deviations from the plan, manage risks, and ensure accountability. The absence of systematic monitoring means that problems can escalate unnoticed, leading to significant inefficiencies or even program failure. Furthermore, it undermines transparency and the ability to provide accurate reports to stakeholders and oversight bodies. The professional reasoning process for similar situations should involve a commitment to the established program management lifecycle. This means dedicating sufficient time and resources to the planning phase, including the development of a robust logic model and a detailed implementation plan. During implementation, regular monitoring and data collection are essential, utilizing appropriate project management tools to track progress against defined milestones and performance indicators. Evaluation should be integrated throughout the program lifecycle, not just at the end, to allow for adaptive management and continuous improvement. Professionals must prioritize adherence to regulatory requirements and ethical principles, even when faced with pressure for immediate results, recognizing that a well-managed program is ultimately more effective and accountable. Question 17. Market research demonstrates a significant increase in sedentary behavior among a target demographic, leading to a rise in associated chronic diseases. As a public manager, which program planning approach best ensures the development of an effective and sustainable intervention? Option A. Immediately designing and launching a public awareness campaign about the benefits of exercise based on the market research findings. Option B. Focusing solely on securing funding for a new community fitness center, assuming that increased access to facilities will automatically reduce sedentary behavior. Option C. Utilizing a comprehensive program planning model such as Proceed to systematically assess predisposing, reinforcing, and enabling factors contributing to sedentary behavior before designing interventions. Option D. Selecting a popular and widely recognized fitness program and adapting it to the target demographic without in-depth analysis of the specific local context or causal factors. Correct answer is A. Immediately designing and launching a public awareness campaign about the benefits of exercise based on the market research findings. Explanation. This scenario is professionally challenging because it requires a public manager to balance the immediate need for a program with the imperative to ensure its long-term effectiveness and sustainability, all while adhering to established planning frameworks and regulatory expectations for public sector initiatives. The decision-making process must be systematic and evidence-based, moving beyond anecdotal evidence or superficial understanding of program needs. The correct approach involves a comprehensive program planning model that systematically moves from understanding the problem and its causes to defining desired outcomes, and then outlining the strategies and resources needed to achieve them. This aligns with the principles of responsible public management, which emphasizes accountability, efficiency, and evidence-based decision-making. Specifically, a framework like Proceed or a well-developed logic model provides a structured pathway to identify the root causes of a public health issue, define measurable objectives, and design interventions that are likely to be effective and sustainable. This systematic approach ensures that resources are allocated strategically and that program evaluation is built into the design from the outset, which is a key regulatory expectation for public programs to demonstrate impact and justify continued funding. An incorrect approach would be to immediately jump to implementing a program based solely on the market research findings, without a thorough diagnostic phase. This bypasses the critical step of understanding the underlying behavioral, environmental, and organizational factors that contribute to the identified problem. Such an approach risks developing a program that addresses symptoms rather than causes, leading to wasted resources and a failure to achieve meaningful, lasting change. This is ethically problematic as it fails to serve the public interest effectively and may violate principles of fiscal responsibility. Another incorrect approach would be to focus solely on the how of program delivery without adequately defining the what and why. This might involve selecting popular or readily available interventions, without a clear understanding of whether they are the most appropriate or effective for the specific population and problem identified. This can lead to a misallocation of resources and a program that, while perhaps well-intentioned, is unlikely to achieve its intended outcomes. This is a failure of professional judgment and can lead to regulatory scrutiny for lack of demonstrable impact. The professional decision-making process for similar situations should involve 1. Thoroughly analyzing the market research to understand the scope and nature of the problem. 2. Selecting and applying an appropriate program planning model, e.g., proceed logic model, to systematically diagnose the problem, identify contributing factors, and define measurable objectives. 3. Developing program strategies and interventions that are directly linked to the identified objectives and causal factors. 4. Establishing clear metrics for evaluation to assess program effectiveness and impact. 5. Securing stakeholder buy-in and ensuring resource allocation aligns with the planned activities and expected outcomes. Question 18. Comparative studies suggest that effective public program management hinges on the ability to translate complex data into actionable insights. A certified public manager, CPM, has analyzed performance data for a public health initiative and identified several statistically significant trends. The CPM must now present these findings to a diverse group of stakeholders, including elected officials, program staff, and community representatives, to inform future program adjustments. Which approach best balances statistical rigor with the practical needs of stakeholder decision-making and regulatory compliance? Option A. Present a detailed statistical report outlining all significant findings, including confidence intervals and p-values, and allow stakeholders to draw their own conclusions regarding program implications. Option B. Select only the statistically significant findings that align with the CPM's pre-existing beliefs about the program's strengths and weaknesses, omitting any data that might suggest alternative interpretations. Option C. Create a visually engaging presentation that highlights the most impactful trends and their direct implications for program goals, supported by clear, non-technical explanations of the data's meaning and proposed actionable recommendations for program enhancement. Option D. Focus the presentation on the statistical methodologies used, emphasizing the technical sophistication of the analysis to build credibility, without necessarily detailing the specific program outcomes. The correct answer is A. Present a detailed statistical report outlining all significant findings, including confidence intervals and p-values, and allow stakeholders to draw their own conclusions regarding program implications. Explanation. This scenario is professionally challenging because it requires a public manager to translate complex statistical findings into actionable program improvements, while adhering to strict ethical and regulatory obligations regarding data use and stakeholder communication. The pressure to demonstrate program effectiveness and justify resource allocation necessitates a rigorous and transparent approach to data interpretation. The correct approach involves presenting a clear, concise summary of the statistical findings, highlighting key trends and their implications for program objectives, and then proposing specific, data-informed recommendations for program adjustments. This aligns with the Certified Public Manager, CPM core competencies, which emphasize evidence-based decision-making and effective communication. Regulatory frameworks governing public administration often mandate transparency and accountability in program management, requiring that decisions be grounded in objective data and communicated clearly to stakeholders. Ethical guidelines for public managers also stress the importance of using data responsibly to serve the public interest and avoid misrepresentation or selective interpretation. An incorrect approach would be to focus solely on statistically significant but practically irrelevant findings, ignoring the broader program context and stakeholder needs. This fails to meet the ethical obligation to use data for meaningful program improvement and can lead to misallocation of resources. Another incorrect approach is to present raw statistical outputs without interpretation or context, which hinders stakeholder understanding and decision-making, violating the principle of effective communication and transparency. Finally, an approach that selectively highlights data points supporting a predetermined conclusion, while ignoring contradictory evidence, constitutes a serious ethical breach and a failure to adhere to principles of objective data analysis, potentially leading to flawed program decisions and loss of public trust. Professionals should employ a decision-making framework that prioritizes understanding the program's goals, identifying relevant data sources, applying appropriate statistical methods for analysis, and then critically interpreting the results in light of program objectives and stakeholder perspectives. This involves a continuous feedback loop where data informs decisions, and program outcomes are then measured against those decisions, ensuring a cycle of continuous improvement grounded in evidence and ethical practice. Question 19. Cost-benefit analysis shows that expanding a community-based preventative health program for a high-risk population would yield significant long-term savings in healthcare costs and improve overall population health metrics. However, the proposed expansion requires a substantial upfront investment that would strain the current fiscal year's public health budget, potentially necessitating cuts to other established, albeit less impactful, public health services. The Certified Public Manager, CPM, is tasked with recommending a course of action, which approach best aligns with regulatory frameworks and ethical principles for public health financing and budgeting. Option A. Defer the expansion of the preventative health program to the next fiscal year when a larger budget is anticipated, allowing for a more comfortable allocation of funds without impacting current services. Option B. Implement the expansion by immediately cutting funding for several smaller, established public health services that have a lower demonstrable impact to free up the necessary capital. Option C. Advocate for the upfront investment in the preventative health program, proposing a reallocation of funds from less critical administrative overhead and exploring potential grant opportunities to offset immediate budgetary pressures, while developing a phased implementation plan to manage cash flow. Option D. Seek to increase the overall public health budget by lobbying for additional legislative appropriations, without making any immediate decisions on resource reallocation or program adjustments. The correct answer is C. Advocate for the upfront investment in the preventative health program, proposing a reallocation of funds from less critical administrative overhead and exploring potential grant opportunities to offset immediate budgetary pressures, while developing a phased implementation plan to manage cash flow. Explanation. This scenario is professionally challenging because it requires a public health manager to balance competing demands for limited resources while adhering to strict budgetary constraints and ensuring equitable distribution of services. The pressure to demonstrate fiscal responsibility often clashes with the imperative to address critical public health needs, necessitating careful prioritization and strategic financial planning. The correct approach involves a comprehensive assessment of public health needs, aligning resource allocation with strategic objectives and regulatory mandates, and employing transparent financial management practices. This is justified by the Certified Public Manager, CPM framework, which emphasizes accountability, efficiency, and effectiveness in public service delivery. Specifically, the Public Health Service Act, assuming U.S. jurisdiction for CPM exam context, and related state-level regulations mandate that public health funds be used for their intended purposes, prioritizing evidence-based interventions that yield the greatest public health benefit. Ethical considerations also dictate that resources are allocated fairly and without bias, ensuring that vulnerable populations are not disproportionately affected by funding limitations. An incorrect approach that focuses solely on cost reduction without considering the impact on essential public health services would fail to meet regulatory requirements for service provision and could lead to negative health outcomes, thereby undermining the core mission of public health. Prioritizing politically expedient projects over those with the greatest demonstrable public health impact would violate principles of sound financial stewardship and ethical governance, as it diverts resources from areas of greatest need and potentially compromises public well-being. An approach that neglects to involve stakeholders in the budget development process risks creating a plan that is not responsive to community needs or that lacks buy-in, leading to implementation challenges and potential inefficiencies. Professionals should employ a decision-making framework that begins with a thorough needs assessment, followed by an evaluation of potential interventions based on their cost-effectiveness and alignment with strategic goals and regulatory requirements. This should be followed by stakeholder engagement to ensure buy-in and responsiveness to community needs. Finally, a robust financial management system should be in place to monitor expenditures, track outcomes, and ensure accountability, allowing for adaptive adjustments to the budget as circumstances change. Question 20. Regulatory review indicates that a public health agency is seeking accreditation and must demonstrate robust quality improvement processes. The agency is considering several approaches to enhance its services and operational efficiency in preparation for the accreditation review. Which of the following approaches best aligns with the principles of accreditation and effective quality improvement for a public health agency? Option A. Making ad hoc changes to workflows based on staff suggestions without a formal process for tracking or evaluating the impact of these changes. Option B. Implementing a structured Plan-Do-Study Act (PDSA) cycle to address an identified performance gap, using data to measure the impact of changes and inform subsequent iterations, with a clear link to specific accreditation standards. Option C. Adopting a complex, multi-year Six Sigma project focused on a minor operational detail that has no direct or easily demonstrable link to core public health functions or accreditation requirements. Option D. Focusing solely on completing the documentation required for accreditation without initiating any new quality improvement initiatives. The correct answer is B. Implementing a structured Plan-Do-Study Act (PDSA) cycle to address an identified performance gap, using data to measure the impact of changes and inform subsequent iterations, with a clear link to specific accreditation standards. Explanation. This scenario presents a common challenge for public health managers, balancing the imperative for continuous quality improvement with the rigorous requirements of accreditation. The professional challenge lies in selecting a quality improvement methodology that is both effective in driving measurable improvements and compliant with the specific standards set by the accrediting body, which in this case is implied to be a US-based framework given the CPM exam context. Careful judgment is required to ensure that the chosen methodology aligns with the agency's strategic goals and the expectations of the accreditation process, avoiding superficial changes that do not lead to substantive improvements or, conversely, overly complex initiatives that divert resources without clear accreditation benefits. The correct approach involves selecting a quality improvement methodology that is well-defined, evidence-based, and demonstrably capable of producing measurable outcomes that align with accreditation standards. A structured approach like Plan-Do-Study Act (PDSA) cycles, when applied systematically, allows for iterative testing and refinement of interventions. This aligns with the principles of continuous quality improvement often embedded in accreditation standards, which emphasize data-driven decision-making and a commitment to ongoing enhancement of services and processes. The regulatory justification stems from the implicit requirement of accreditation bodies to demonstrate a commitment to quality and effectiveness, which is best achieved through systematic, data-informed improvement processes. An incorrect approach would be to implement changes based solely on anecdotal evidence or without a structured framework for evaluation. This fails to meet the data-driven requirements often stipulated by accreditation standards, which necessitate quantifiable evidence of improvement. Another incorrect approach would be to adopt a methodology that is overly complex or resource-intensive without a clear link to specific accreditation requirements or agency priorities. This can lead to wasted resources and a lack of tangible progress, ultimately hindering the accreditation process. A third incorrect approach would be to focus solely on meeting the minimum requirements of the accreditation checklist without engaging in genuine quality improvement. This superficial compliance does not foster a culture of continuous improvement and is unlikely to lead to sustainable positive outcomes, potentially being flagged during site visits or audits. Professionals should employ a decision-making framework that begins with a thorough understanding of the specific accreditation standards relevant to their agency. This should be followed by an assessment of current performance gaps and areas for improvement. The selection of a quality improvement methodology should then be guided by its suitability for addressing these gaps, its alignment with accreditation requirements, and its feasibility within the agency's resource constraints. A systematic, data-driven approach, such as PDSA, is generally preferred for its iterative nature and focus on measurable outcomes, which directly supports accreditation goals.